Today's topic was requested by Dr. Devos. I'm switching it up a bit today. I'm not talking about thyroid or peptides or anything TRT related, but instead I'm going to talk about progesterone, but not in men, but in women.
This is the TRT and Hormone Optimization YouTube channel. And if you want to learn all about the science-based information on this topic, consider subscribing, hit that notification bell, and you'll be on your way.
Dr. Devos says that we've got more and more females who are interested, wanting to learn about HRT, and we're expanding out, we're reaching out to them. So let's talk about progesterone. So the first question I received was, should someone be on progesterone or not? Well, if you're on HRT and you have an intact uterus, then it's wise to. It's not an absolute mandatory, it's not an absolute must, but it's a good practice to do. Progesterone is going to help you maintain and or induce regular menses. This is called the cyclical method of taking progesterone. Essentially, the patient is just mimicking having a monthly cycle. Now, if the patient has had a hysterectomy and had her goodies removed, then technically she doesn't have to take progesterone, but if it'll give her symptomatic improvement, help her sleep better, help her anxiety, help her overall just have a better sense of well-being, then sure, why not? Why not get on progesterone? It's not going to hurt anything. But for some patients, having a period inducing regular cycles is somewhat burdensome, and they're just kind of over it, and therefore they may elect not to do that. I will say, though, most of my female patients do at least induce a period every few months, as overall they just said they feel better doing so. Okay, so that's the cyclical method. And the other method of taking progesterone is simply having a standing prescription that you take at the same time of day, every day, typically at bedtime, and having a little bit of food on the stomach does improve and increase the absorption and the efficacy of progesterone. Next question I got was, when should you take progesterone? And typically it's prescribed at bedtime. Why at bedtime? Well, I mentioned a few benefits from it. That kind of gave it away. Progesterone acts as an anxiolytic, meaning it can reduce anxiety. It's also somewhat sedative. It's not going to completely put you out or anything, but it does induce some sedation because it converts to 5-allopregnenolone. Also, some women say they kind of feel a little woozy or maybe a little bit euphoric when they take it. This is a good thing. Overall, progesterone is great for improving anxiety, insomnia, and overall having a better sense of well-being. So lastly, besides taking progesterone orally, believe it or not, I have some patients take the medication, take the capsule, rectally. Now, rectal absorption is somewhat hit or miss in patients, and patients report some feel amazing, some feel great, and others can't even tell if they're taking it or not. This is mainly due to the absorption, which is mediocre at best. Roughly about a third of it will get absorbed rectally, and it'll get taken to hepatic metabolism via the hepatic portal. Well, that was a brief primer on progesterone. I appreciate y'all tuning in. Again, this is Justin from Tennessee. If y'all have any questions, reach out. We're always here to help. Thank you.